Have you ever heard of a skin condition that makes an animal's hair mat together, almost like tiny paintbrushes?
Yeah, and it can turn their hide into this really thick, crusty mess.
Exactly. It's often called rain rot or maybe lumpy wool disease, and it's caused by this uh, really fascinating bacterium, surprisingly widespread too.
It is.
So, welcome everyone to this deep dive into dermatophilosis.
Right, this is a contagious skin disease caused by the bacterium Dermatophilis congolensis. And, it affects a huge range of animals globally.
But today we're focusing on some maybe less expected hosts, camels and deer.
Exactly. And we'll also touch briefly on its rare ability to infect humans. It's usually just a mild skin rash, nothing serious typically, but it's overwhelmingly an animal health issue.
Okay, so our sources for this deep dive today are a couple of research reports. One's called Dermatophilosis in Camels and Deer, and the other is Dermatophilosis, Camels and Deer Dermal Infection Review. Our mission really is to break these down for you, give you a comprehensive understanding of this unique bacterial infection, its impact, how it's managed, both in, domestic livestock and wildlife.
Think of us as guides, I suppose. We'll pull out the key insights and why this research actually matters.
All right, so let's dive in. We're talking about Dermatophilus congolensis. Our sources describe it as gram-positive filamentous, almost fungus-like in some ways.
That's right. It has these fungus-like characteristics, but what really makes it stand out, I think, is its appearance under the microscope.
Oh, yeah. What's that like? I hear it's pretty unforgettable.
It really is. Imagine looking through the scope and seeing these tiny shapes that look like railroad tracks, or sometimes they're called tramcar lines,
Wow.
or even stacked coins. It's that unique structure that's, well, key to its identity.
Okay.
And it's not just the looks. This bacterium is incredibly versatile. It's what we call a facultative anaerobe, meaning it can live with or without oxygen. That adaptability is a huge part of why it's so widespread and, honestly, why it can be so tough to deal with.
That's incredible. So it's not just unique looking, it's a master adapter. What about its life cycle? How does this clever little organism actually get around and cause trouble?
Well, the mechanism is pretty neat, actually. It has two main forms. There are these filamentous hyphae branching structures, basically.
Yeah.
And then there are these highly motile zoospores. The filaments divide, forming packets of what are called cocoid cells, and these mature into those zoospores.
Motile zoospores. So they move.
They do. Think of them as the pathogen's little delivery vehicles. They're the key to spreading the infection.
So are you saying these zoospores are just sort of waiting for the right moment, like a rainy day and a scraped knee, so to speak?
That's pretty much it. They are opportunists. These motile zoospores, they get activated by wet conditions.
Moisture.
Yes, moisture is critical. But importantly, they can only really establish an infection if they penetrate skin that's already been compromised somehow.
Compromised how?
We're talking cuts, abrasions, even tiny bites from things like ticks and flies, ectoparasites.
Okay, so damage plus water.
Exactly. Damage plus water. So now you can see why it's most prevalent in, say, tropical and subtropical climates. Lots of rainfall, high humidity. It's the perfect storm for this bacterium.
That makes perfect sense. So if an animal is already dealing with wet or humid conditions, maybe some skin trauma, perhaps poor hygiene, overcrowding, even a weakened immune system,
Yeah.
all these factors kind of create that perfect storm.
Precisely. Those are the predisposing factors. They significantly increase the risk.
And once that storm hits, what actually starts to happen on the animal's skin? Our sources paint a pretty vivid picture, don't they?
They really do. And that's where we see the hallmark of dermatophilosis. Vets call it exudative dermatitis.
Which means,
Basically a wet, inflamed skin condition, oozing sometimes. This quickly leads to crusts and scabs forming.
and those early lesions are really distinctive, right? The paintbrush ones.
That's the classic sign. The hairs mat together, sticking straight up, forming these little tufts that look just like tiny paintbrushes. It's a unique visual sign for anyone looking at affected animals.
Okay. And then it gets worse.
Yeah, as the disease progresses, these individual lesions tend to coalesce, merge together. They form these thick, really crusty scabs.
Ouch.
And here's where it can get quite painful for the animal. If you try to remove those scabs, the surface underneath is often moist, maybe bleeding, sometimes even filled with pus.
Yikes. And in advanced stages.
It can get really severe. The lesions can become widespread, covering large areas of the body. This leads to significant hair loss, that's alopecia,
Right.
You'll also see a general loss of body condition. Sometimes even wart-like growths can appear.
And just general discomfort, I imagine.
Absolutely. General signs include pruritus, that's intense itchiness, obvious discomfort, potentially lameness if the lesions are bad on their limbs.
And for wildlife, like deer, you mentioned weight loss.
Yes, that's a critical concern, especially for wildlife. They might lose weight simply because they're too uncomfortable or itchy to graze or feed properly. That can really impact their survival.
So when a vet suspects dermatophilosis, how do they actually confirm it? Is it just based on looking at these signs?
Well, the clinical examination is key, yes, based on that characteristic appearance of the lesions. But for a definitive diagnosis, cytology is usually crucial.
Cytology.
Microscopic examination. You take a stain smear from a crushed scab, or maybe an impression smear from under a scab. Put it under the microscope.
You see.
You see those distinctive railroad track or tram car lines, bacteria. It's usually very clear.
That microscopic view sounds incredibly distinctive. Is it always that clear-cut, though? Or could it be missed or confused with something else?
That's a fair question. While it's usually distinctive, sometimes other skin conditions, maybe fungal infections or mange, can complicate the picture visually.
So what other tools do vets have?
For absolute certainty, they can also culture the bacteria.
Grow it in a lab.
Exactly. Take skin samples or crusts, grow them on blood agar. Dermatophilis congolensis forms these small, yellowish hemolytic colonies. That confirms it.
Okay.
And finally, there's histopathology. That involves taking a small biopsy of the affected skin.
A tissue sample.
Right. Examining that allows them to see the characteristic branching filaments right within the layers of the epidermis and see the body's inflammatory response at a deeper level. So combining these methods gives a very robust diagnosis.
Okay, that makes sense. So we've covered the general picture, the pathogen, the signs, the diagnosis. But our sources really highlight how this disease plays out, maybe differently, or perhaps surprisingly similarly, in specific animals like camels and deer.
Yes, and that's where the nuance comes in. Let's start with camels, particularly dromedary camels.
The one-humped ones.
Right, in places like Kenya, Sudan, Saudi Arabia, those tropical, subtropical regions, dermatophilosis is widespread and, frankly, economically devastating.
Economically, how so?
Well, think about communities reliant on camels. This disease leads to poor quality hides, which affects leather production. It can reduce meat and milk yields.
Ah, okay. And it seems camel calves are especially vulnerable.
That's right. The disease often hits hardest during the wet seasons, naturally, and camel calves are typically more susceptible and get more severely affected than adult camels.
What does it look like on them? Similar signs.
Very similar. That exudative dermatitis, thick, greasy scabs, the paintbrush lesions. You often see it on the rump where the wool mats up badly. Sometimes hard white crusts form there, or on the flanks, neck, lower abdomen. And it can become generalized, covering large areas.
Does it affect their appetite?
Interestingly, appetite might not be directly affected initially, but their overall body condition often deteriorates significantly.
And you mentioned mortality.
Yes, unfortunately. In severe outbreaks, calf mortality rates can be quite high, ranging from 10% up to even 30% in some reports. That's a huge blow.
That's terrible. A huge economic hit, like you said. But there's some good news, too. Our sources mention effective treatments for domestic camels.
Yes, that is a positive. For domestic camels, antibiotic treatment is generally effective. There was one study mentioned that found a 100% cure rate using a specific combination therapy.
What was that?
A long-acting oxytetracycline antibiotic combined with oral potassium iodide.
Interesting. So treatment works, but control is also key.
Absolutely. Control focuses heavily on minimizing those risk factors we talked about earlier. Tick control is important, as ticks can damage skin and potentially transmit the bacteria. Also, things like vitamin and mineral supplementation can help improve the camel's overall health and make them more resilient, possibly speeding up recovery too.
Okay, so that's camels.
Yep.
Now, shifting gears to deer. That's the Cervidae family, so various deer species, but also elk, moose.
Right.
The underlying cause, the bacterium, and the general look of the disease, the crusts, the scabs, sound similar. But are there specific ways it presents or impacts deer that are distinct?
There are some distinctions, mainly in location and impact. While you see those familiar crusts and scabs in deer, the lesions seem to cluster most commonly around the face, ears, neck, back, and limbs.
Okay.
In severe cases, just like in camels, lesions can cover large parts of the body. But the critical difference, I think, is the impact.
How so?
With domestic camels, it's primarily an economic issue, and we can intervene relatively easily with treatment. With wild deer, however, this disease can directly impact their survival.
Because of the weight loss.
Exactly. That weight loss we mentioned earlier from being too uncomfortable to graze properly. For a wild animal, that can be fatal, especially heading into winter or if they're already stressed.
That's a stark difference in impact then.
Mm-hmm.
What about treatment for deer? Obviously harder in the wild, but what do the sources suggest? Perhaps for managed populations.
Right, treatment in truly wild populations is very challenging. But for deer in captive or managed settings, the approach is often two-pronged. For more localized issues, topical antiseptic washes like chlorhexidine can be used, cleaning the lesions, reducing the bacterial load on the skin.
Makes sense.
But for severe or widespread cases, systemic antibiotics are needed. Things like penicillin or oxytetracycline, similar to other animals.
And prevention, especially in those managed herds.
Prevention strategies mirror what we've discussed. Good environmental management trying to reduce exposure to constantly wet, humid conditions where possible, definitely insect control, and regular monitoring of the animals to catch any early signs and treat promptly before it spreads.
So if we kind of connect this back to the bigger picture, it really highlights how different living conditions, domestic livestock versus wildlife, fundamentally change how you approach diagnosis, treatment, and control, doesn't it?
Absolutely. Managing a disease like this in vast, free-ranging wild populations presents enormous complexities compared to managing it in a controlled domestic environment like a camel herd
Very
for
different.
different challenges.
Okay, so considering everything we've discussed, the pathogen, the signs, camels, deer, what does this boil down to for the general approach? Treating and preventing dermatophilosis, regardless of the specific animal.
Well, fundamentally, the general treatment principles start with topical therapy.
Cleaning the skin.
Exactly. Antiseptic shampoos like chlorhexidine and thorough washing of the affected areas. The goal is to physically remove those crusts and reduce the bacterial load right there on the skin surface.
And if that's not enough,
Then systemic antibiotics are crucial, especially for severe or widespread cases. The sources mention several effective options. Penicillin, oxytetracycline, erythromycin are common ones.
right.
And critically, you can't forget environmental management. That's paramount. Keep affected animals as dry as possible. Reduce their exposure to constantly wet environments. Improve overall hygiene and husbandry practices. It all ties together.
And on the prevention side, it sounds like good hygiene is really number one.
It really is. Maintaining good hygiene, trying to reduce overcrowding, which can increase humidity and contact, and preventing prolonged exposure to wet conditions, these are all essential.
What else?
Minimizing skin trauma is important too, so avoiding practices that might cause skin injuries. Treating any wounds promptly so they don't become entry points for the bacteria.
And the insects.
Yes, managing insect populations, particularly biting flies and ticks. They not only create skin wounds, but can potentially act as mechanical vectors, spreading the bacteria from animal to animal.
Okay. And for anyone managing a herd?
Regular monitoring, just keeping a close eye on the animals, inspecting them for any early signs. Catching it early and treating promptly is the best way to prevent it from spreading through the group.
It sounds like overall, if you catch it early and treat it appropriately, the prognosis for dermatophilosis is generally pretty good.
Generally, yes. With early detection and the right treatment, most animals recover well.
But I imagine chronic cases could be a real headache.
You're right. Chronic, long-standing cases can be more challenging. They might require prolonged therapy, maybe repeated treatments, and ongoing environmental management becomes even more critical to prevent it from just coming back again and again. It really emphasizes the importance of that early intervention.
Okay, so let's maybe recap the key insights we've explored today.
Sounds good. We really peeled back the layers on Dermatophilis congolensis, a unique bacterium distinctive under the microscope.
Railroad tracks.
Exactly. And it thrives in moisture, needing that compromised skin to really get a foothold.
We saw how it manifests in those surprising ways, those classic paintbrush lesions.
And we explored its significant impact, both on domestic camels, where it's a serious economic issue.
Right, affecting hides, milk, meat production, and tragically, calf survival rates sometimes.
And also on wild deer, where it can directly threaten their survival due to discomfort and weight loss.
And throughout all that, we uncovered the common threads in treatment and prevention, didn't we? Emphasizing things like hygiene, environmental control, keeping animals dry, insect management, and really that crucial early intervention.
Absolutely.
So hopefully, you listening now have a deeper understanding of this fascinating, maybe often overlooked, bacterial infection that impacts animal health across the globe.
And this knowledge isn't just for vets, is it? It really sheds light on how environmental factors, the way we manage animals, even insect populations, how all these things play a crucial role in how diseases emerge and spread.
It really does.
So, maybe a final thought to leave you with. Considering how vital moisture and skin trauma are for Dermatophilis congolensis to thrive, what might be the long-term implications? How might we manage diseases like this in a world where we're seeing changing climate patterns, potentially more extreme weather events, maybe more moisture in some areas?
And increased human-wildlife interaction, too.
Exactly. How does that affect the spread and management of these kinds of diseases going forward? Something to ponder, perhaps, as you continue your own deep dives into the world around you.